Okay, so today I'll be starting an IV and starting the fluids for the IV. So I'm first going to go into my MAR and check what kind of fluids we're going to need, the amount we're going to need, the infusion rate, and double check the 6 patient rights and double check that I'm getting them for the right patient. So first I'm going to open my fluid bag. And I'm going to write a sticker out that says patient's name, the date, my initials, and we'll just put that on the fluid. And then I'll need my fluid bag and my tubing. So I'm going to go to the patient's room and double check that it's the right patient with 2 identifiers, so it could be name and birth date. Wash my hands. We'll put the IV fluids on. We'll open our tubing. I'm just going to make my clamp go all the way down. Okay, so I'm going to take this end, I'm going to take this blue rubber piece off. Take off this, puncture my IV bag. And then I'm going to squeeze and fill up the container about halfway. And then I'm going to pull this, I'm going to push back my clamp and prime my tubing. And then re-clamp it. Okay, now that we have our tubing ready, we're going to start the IV. So we want to make sure that we're at a good working height. We'll do 2 patient identifiers, so it could be name and date of birth. We're going to find the arm, anything that we're going to work with, and I'm going to take and put a pad down just in case any blood comes out. We're going to get our tourniquet and place it 4 to 6 inches above the vein we're going to use. Put our tourniquet on. Then we're going to find the vein and make sure that has rebound when we push it. Once we've found the vein, we'll take the tourniquet off and we'll get our supplies ready. So I'll have an IV needle and catheter and some alcohol prep pads. I'll get a piece of tape and split it in half. We'll need a saline flush. We're going to connect it to the to our system that will link it to for meds or the IV fluids. We're going to open our 2x2. And then we'll also open our clear IV cover or Tegaderm. Okay, so now I'm going to wash my hands. I'll put on a pair of gloves. We're going to reapply our tourniquet. we're gonna take our alcohol prep pad, clean the skin. And we'll open our IV. And you want bevel up. We're gonna go about at a 30-degree angle into our vein that we're gonna choose. You'll feel a pop. And then once you get blood return, you'll pull this off and you'll just advance your catheter. You'll put on your stopper. Then we're gonna push 5 mils fluid in. Gonna take our piece of tape and go right below to where the catheter is. We're gonna remove our flesh. We're gonna take our 2x2, put it underneath our port. We're gonna recap this needle and put it in our sharps container. Then we'll take our IV cover and place it over our IV. And on this, you'll have your date, your initials, and then the gauge you used. And we used a 20 gauge today. And there will be your finished IV. And then we'll apply it to we'll connect it to the fluids that we have started. So you'll want to clean with an alcohol pad. And apply your fluids. Okay, so now we have our patient connected to the fluids, and now we'll explain how you figure out an infusion rate. So we have a 0.9 normal saline bag that we're going to infuse over 6 hours. This says that it's 10 drops per milliliter. So the whole time it'll be 167 milliliters an hour. We'll divide that by 60 and it'll give us about 2.7. Then we'll times that by 10, which is our drops per milliliter. And so it'll be about 28 drops a minute. So you can test that by when you take your clamp and open it, you'll time it for a minute and you'll make sure, or you can do for like 30 seconds and see if like 14 drops fall. So we'll get all that. As your fluids are running, you want to be sure to be letting your patient know, especially if you inserted the IV like right on their elbow. You want them, it'll work the best if they keep their arms straight, if they don't mess with it. Have them report any signs of swelling, painful, burning. You should also be checking your fluids and their IV probably about every hour, and make sure that everything's going well. Then I will clean up my station. I will wash my hands and I will come check on them every hour.